Good morning, students. Today we will see about the disorders of blood. Mostly for GNM, BSc and post-basic BSc, question may come as a form of a disorder of blood or maybe a short notes on anemia or erythroblastosis fetalis. It may come. Okay, so we will see what is anemia. So anemia is one of the major blood disorder. Okay, we have seen normal value. When it is decreasing, we are dividing into mild anemia, moderate anemia, and severe anemia. Anemia is the root cause of all the problems because you know very well. We are measuring with how much amount of the hemoglobin and RBCs are present. They are doing an enormous function in the blood. They only carry the oxygen, minerals, hormones, everything. So actually, when they are in a very less number, due to hypoxia or continuous hypoxia, high altitude, or the what are the different types of anemia, different causes are present. So what will happen, slowly organs will be deprived with all the major nutrients because of the reduction of the either the amount of RBC or size of the RBC, whatever it may be, it end up with the anemia. According to that, we have named the anemia in a different one. Okay. First one is the size of the hemoglobin. Actually, this is the hemoglobin. You know what is the size and shape, right? Biconcave. This is the 7.8 mu diameter. When you see the gut section, 2.5, middle will be a 4 mu millimeter. When the size is smaller than this normal one, it is microcytic, normocytic, and macrocytic when it is bigger in size. About the amount of hemoglobin, so if you like a hypochromic, normochromic, and the hyperchromic. What is this one? MCH. It is determined by the MCH. Mean corpuscular hemoglobin is less, it is called the hypochromic. When it is normal, it is normochromic, and when this mean corpuscular hemoglobin is more, it is the hyperchromic. And also due to some causes like due to excessive bleeding, post hemorrhage, due to accident, or hemolytic anemia, hemolysis. Okay, so that is one. And then defective blood formation. So this is about the size we have seen, and also by the defective blood formation. What all the defects will be there? This one first is a nutritional anemia. Nutritional anemia example is a pernicious anemia. In the nutrition diet itself, we are taking lack of iron and folic acid, and also whatever the material what we are eating is less nutritious. Foodstuffs, lack of absorption. So intrinsic factor is very important to absorb this vitamin B12 to synthesis of iron. Then will be aplastic of the bone marrow. Why it is aplastic? Due to exposure of some radiations or X-rays or some chemical substances people has taken, the bone marrow not able to produce, even though kidneys are producing erythropoietin, they cannot able to produce the RBCs, right? And then hemolytic may be due to hereditary. Sometimes the RBC is not a biconcave, it's like a spherical shaped sickle cell anemia. If you see the shape of this one will be in a sickle shape. How these RBCs can do their functions, carrying hormone, any function. So there will be shunted growth. Mostly this you can see in countries like Saudi Arabia. Mostly consanguineous marriage people, they are doing, mostly they will go for the blood transfusion. Due to blood transfusion, they may develop another diseases also. Next one will be the thalassemia. Thalassemia also is one of the bleeding anemia. One of the important like a congenital problems. It is also from the hereditary it is coming. Next will be the erythroblastosis fetalis. What's happening in erythroblastosis fetalis? When the mother is having a positive blood group or the child is having a negative blood group, what's happening during the delivery? Some amount of the blood is going from the umbilicus to the mother's circulation. So what happened to when there is a next baby form, there is a agglutination, some problems will be occur, and the destruction of RBC will be taken place for the next child. So to prevent that, we have to go for some injection, Rohan. That injection you have to take, otherwise it will be the condition, it is called the erythroblastosis fetalis. That's a child RBCs all will be destroyed. Okay, the baby will be like a yellow color baby, or sometimes naturally this more destruction will lead into the abortion. So what's happening when there is the opposite blood group between the mother and the child? First delivery will be okay, and 50 ml to 100 ml blood will be go back after the delivery from the umbilical cord to the mother. Then next baby will be getting affected. It's called the erythroblastosis fetalis. And also another one is acute hemolytic anemia. Maybe acute hemolytic anemia, you developed anemia due to some drugs and chemicals you are taking, cancerous treatments, or exposed to toxins, or some of the autoimmune disorders like SLE or other diseases, and malaria, ionizing radiation, you are exposed to injuries and burns. So these are all the reasons you will develop the anemia due to get of some of the disease conditions. Other one is called the normocytic normochromic anemia. It will be normocytic normochromic anemia will be due to the severe hemorrhage, chronic infections, and hemolytic diseases. Okay, secondary polycytic anemia, that is mainly due to the physiological, this one due to people are living in a very high altitude, polycythemias and pathological polycythemia. It's a chronically you are living in a area, or the always getting a hypoxia, maybe in a high altitude, in a mountain you are living. Every time that feedback mechanisms will be doing erythropoietin producing, maybe end one fine day it will be failure, you will develop the secondary polycytic anemia. Okay, so this is about the disorders of the blood mainly by the hemoglobin. So we have seen about with the RBC, we have seen only blood is having only red RBC is a element. We have also the WBCs and other form, isn't it? So these are also the disorder of leukocytes mainly, whether this is increasing or decreasing. If you see leukocytes count is like decreasing, what is the leukocytosis? If the this what decreasing, it's leukopenia. It is increasing leukocytosis. So abnormal increase or decrease, whatever it may be, it will end up in some of the disorder, and is abnormally so much it is increasing, the condition is called the leukemia. Okay, type of a blood cancer. So increase or decrease in the any one type of RBCs like neutrophilia, eosinophilia, basophilia, monocytosis, lymphocytosis, like that. When decreasing, neutropenia, eosinophilia, basophilia, monocytophenia, lymphocytophenia, you will be telling. And also about your types of leukemia, lymphocytic leukemia and the myelinogenous leukemia. So lymphocytic leukemia, mainly the cancerous products like lymphoid cells, that will be affecting the tissues. Then will be myelinogenous leukemia, will be the neutrophilic leukemia, eosinophilic leukemia, basophilic leukemia, monocytic leukemia are called the myelinogenous leukemia. Then hemorrhagic disorders like thrombocytopenia, vitamin K deficiency. Why vitamin K deficiency? Vitamin K deficiency is essential to prepare the factor number 8. When there is a degrees, vitamin K is essential. When there is a deficiency vitamin K, this factor is end up in a bleeding disorder. That is also will end up in a anemia. Thrombocytosis, the decrease in platelet production due to aplastic bone marrow. Then the increase in platelet production, dissemination of the intravascular coagulation. So it should not be increase or decrease. It will end up in coagulation. We have seen coagulation, how the platelets play an important role in the coagulation. Also bile salts not available for the vitamin K to absorb. So this is the main problem. Then will be the hemophilia. As I told you, these two factors will be getting affected the disorder called hemophilia. Then mainly vitamin K deficiency due to cirrhosis, hepatitis, obstruction of bile duct, and will be the intestinal bacteria not found. Children, newborn children, how the intestinal bacteria, so the vitamin K cannot be synthesis, will not taken place in the large intestine. So this is about the blood disorder. You can remember this algorithm. With this algorithm you can write, surely you can get 5 out of 5.